Infection control is often treated like a checklist. Wash hands, wear gloves, follow isolation signs. Over time, these actions can feel routine, almost automatic. But when infection control becomes routine, patient safety is usually the first thing to suffer. Welcome to the Learning Studio, where we don't just teach theory, we show how knowledge turns into real-world understanding. Many students think infection control is just about rules and policies. In reality, it exists to break the chain of transmission before harm occurs. Every infection begins somewhere, spreads through a pathway, and reaches a vulnerable host. Nursing actions sit directly in the middle of that chain. Think of infection control like stopping a fire from spreading. You don't wait until the entire building is burning. You remove fuel, block pathways, and protect vulnerable areas early. Hand hygiene, personal protective equipment, and isolation precautions serve the same purpose in healthcare. At the bedside, infection control decisions happen constantly. A nurse decides when to perform hand hygiene, when to change gloves, how to handle equipment, and how to move between patients safely. These choices may seem small, but they determine whether microorganisms stay contained or travel from one patient to another. Understanding infection control also explains why some patients are at higher risk. Weakened immune systems, invasive devices, open wounds, and prolonged hospital stays create opportunities for infection. Nurses who recognize these risks adjust their care accordingly, increasing vigilance instead of relying on routine. In hospitals and community settings, infection control is a shared responsibility, but nurses are the consistent presence. From catheter care and wound management to medication preparation and patient education, nurses play a central role in preventing healthcare-associated infections. Many safety protocols are built around nursing practice for this reason. The nclex emphasizes infection control because errors in this area can cause widespread harm. Questions often test whether you recognize when precautions are missing, when equipment is contaminated, or when a patient requires isolation. The focus is not on memorizing guidelines, but on protecting patients through safe behavior. In real nursing practice, patient safety goes beyond preventing infection. It includes identifying hazards, preventing falls, administering medications safely, and speaking up when something feels wrong. Infection control fits into this larger safety mindset. Nurses are expected to act as barriers between risk and patient harm. Effective infection control requires awareness, consistency, and accountability. Nurses do not wait for visible infection to act. They assume risk is present and behave accordingly. This proactive approach protects patients, coworkers, and the broader healthcare environment. Now that you understand how infection control supports patient safety at every level of care, the next step is applying these principles in real situations through clinical case studies. Seeing how small actions prevent serious outcomes is where this knowledge becomes truly powerful. And that's exactly where we'll go next here at the Learning Studio.